excited to be here on another Monday and another edition of the NAMI Tennessee at home live series. It's been going on for over a year and a half. Doing the math is super difficult. So let's just say it's been going on a while. And it happens every Monday at 2 Central, 3 Eastern. And if you're thinking to yourself, how can I remember that? I got a lot going on. Ha! I've got a method for you. See this list right here? NamiTN.org. Sign up for the email list. Not only will you find out about cool things like this right here, and you won't have to remember, but you'll also find out about things like legislative advocacy, our conference, our fundraisers, our walks, our events, our get-togethers, our holiday parties, and our gala. We have a gala. Everything that we do can be conveniently located and found out about right there at NamiTN.org. So please sign up for that to keep in touch with us. All right, enough about all of that. Let's bring on our very, very super cool guest. Jackie, welcome. Can you tell our viewers who you are?
Gabe, hello. Good afternoon. Thank you so much for asking me to be a part of this today. Hi, everyone. I'm Jackie Cavnar. I am the Chief Operating Officer for Mental Health America of the MidSouth. And I am really excited to share a little bit with you today about some of our mental health screenings.
Well, thank you so much for being here. Now, you said that you were with Mental Health America. So for our viewers who do not know, wrong one. Can you tell us a little bit about Mental Health America?
Sure, Gabe, I'm happy to. Mental Health America has been around for 75 years. We were started in 1946 with a $500 grant from the Junior League of Nashville, believe that or not. And Frank Luton from from Vanderbilt University's psychiatry department got us kicked off the ground. So we started out as the Mental Health Association of Middle Tennessee, and we have grown and morphed into Mental Health America through our affiliation with the national organization, Mental Health America. But we serve Middle Tennessee, West Tennessee, and we have a couple of statewide programs that do reach into East Tennessee, and we have a sister organization there in Knoxville, Mental Health Association of East Tennessee, which is also an MHA affiliate. So great partner, great group of people to work with, and just love serving all of Tennessee.
Oh, that's beautiful. Well, thank you so much for your partnership and for being here. Let's get into the meat of why you're here. Today, we're going to be talking about the importance of mental health screenings, which of course leads us right into our very first question. What is a mental health screening?
Yeah, well, Gabe, we have mental health screenings on our website, which is www.mhamidSouth.org. If you go on our website, there's a little button in the upper right-hand corner that will connect you to the screenings. And those go out to our national MHA website where you'll see all of the screenings available to you. And we have 10 screenings for everything from alcohol and substance abuse, possible usage, anxiety, bipolar disorders, depression, eating disorders. There's even a screening if you're the parent of a teenager or a young person and you have concerns, you can go and take the screening for your child. We also have the screening for postpartum depression, one for psychosis, one for PTSD, and then a youth screening for the younger children and preteens and teens to take. And two of the screenings, actually the depression screening and the anxiety screening, are also available in Spanish.
Oh, very, very cool. Now,
Yeah.
do these cost anything? Are they?
No, not at all. They are free and they
Are
are
they confidential?
confidential. They are confidential. We do not collect names or addresses. We do ask for your zip code just so we can try to analyze trends across the state to see where people are experiencing certain feelings or conditions at a time so we can help work with the state and some of our other nonprofit partners and helping to deploy resources in certain zip codes if we see a spike in depression or a spike in anxiety or one of the other conditions. But no, we do not collect your name or your address or anything that would tell us who you are. And one of the reasons we want this to be free and confidential is we really want to reduce stigma, because you may have not reached out for help before, and you're just curious. You want to see if it's something you need to pursue or want to talk to with your doctor or another provider.
Now, that brings me to probably a very important question. So, once you take the screening, this isn't a lock, right? After you're done and you get the results, it doesn't say, haha, you have fill in the blank, and then it
Oh
starts prescribing
no.
you. It's just a screener. Can you talk
Yeah.
about really like how it works, walk us through the process, and what you should do with the results that you get?
Yes, all of the screenings have been developed so that they are evidence based, and many of the questions are questions that a clinician or a provider would use as well. So once you take your screening, please print off your results and take it to your physician, to your nurse practitioner, to your psychiatrist, to your psychologist, to your therapist, anyone that you feel comfortable in sharing that information with, and just say, hey, this is where I landed on this particular tool. Could we start a conversation and dig a little deeper and maybe see how valid it is, or how valid what I'm feeling at the moment is, and just have that conversation with somebody. Just open the door is really what we want you to do.
Wonderful, wonderful. Whoops. I'm too big on the screen. There we go. So you go to the website, you find the screeners. We've got all that. What is it question based? Is it do
It
you meet
is.
with somebody? What does it look like when you take the screener?
Yeah, it's a lot of yes no questions, some multiple choice questions. How many days a month do I maybe feel this way, and you pick 0 to 5, 5 to 10, whatever, or how often do you feel X, um, or have you thought about harming yourself, which that plays into mental health as well. And the screenings will give you a result based on minimal evidence of that condition being present to mild to moderate to severe. So it probably take you about 3 minutes or so to take a screening. You'll just go through a series of about 10 to 15 questions, and once you have your answers there, of course, again, just print those off and get to your healthcare provider or trusted counselor as soon as you can get an appointment.
Now, Kevin from the chat section is asking, should a parent explain the what, who, and why to a child before the appointment? I know you mentioned that you had some screeners for parents. Is it a good idea to involve the child? If they take the screener and they decide, okay, we're moving on to step 2, which is to see a provider, should they tell the child that that's what they're doing? Do you have any recommendations or best practices on that?
Well, I do. Kevin, I tell you what, I am not a clinician. I'm on the business side of our nonprofit and working with the screenings. So I would advise you first to maybe talk to your school counselor or talk to your pediatrician or your child's physician and ask what you should do. I think that would vary from child to child, and you know your child's personality better than I do. So I would defer to a trusted healthcare provider in that situation and let them know what's going on. So that way you're a team on the front end and the child isn't blindsided.
I think that is a great idea. Thank you so much, and thank you, Kevin, for the questions. As always, as Kevin just did, if you have any questions, please ask short questions in the comments. We will do our best to answer them. Today, we're talking about the importance of mental health screenings, and of course, we've learned what they are. Now, one of the anonymous questions that we got when we advertised this, we said, "Hey, it's a mental health screening. They're going to ask you questions. We're going to find out what's going on. It's online." And somebody wrote in, and I love this question: is it safe to poke around with our brains in this manner? Can you talk about the mental health screenings and why it's not? I'm going to use a Halloween reference because it was yesterday. It's not Dr. Frankenstein putting electrodes and convincing
No.
you of stuff. Can you talk about this and assuage some fears that some folks might be having about the screeners?
Sure, I certainly hope so. And again, to the person who asked this question, I want to emphasize I am not a clinician, but I will say from my personal experience and what I've seen with the screenings, um, it's more to reduce stigma because things have changed a lot in the last 15 to 18 months with the pandemic. People are feeling things they haven't felt before. So if you're curious at all if what you're feeling is normal or not normal, or maybe you think you're depressed, or a friend or a family member has said something to you about get over it, and you just feel like you're in a funk and can't get over it, well, this is a good place to just kind of tell if you have some feelings that maybe you need to discuss with a professional, and to take the next steps to get professional help. Uh, everybody goes through different things at different times, with grief or childbirth or job loss or a new job or job change or a kid going to college or any kind of change, a move, or maybe just something's happened. You're going on a month or so where you just don't feel like getting out of bed. Have you ever felt that way before? No. Just go in, grab, do a quick screening on depression or anxiety, and see what results you get.
Thank you so much. One of the things that you mentioned was that because of the pandemic, there's been an uptick in mental health issues. Now, is that what Mental Health America has seen? Have you seen more calls, more screeners, more people reaching
Yes.
out?
Gabe, yes, we did. You would not believe what we have seen. 2019, the screenings were just kind of bumping along, normal average rate, no big spikes, no big changes. And then last year, January, February, kind of the same. March, even still a little bit the same. But most of us had word from a supervisor or a CEO or someone in our company, hey, we don't know what's going on with this pandemic thing. We're going to pack up and go home for 2 weeks. So most of us grabbed our computers, grabbed a couple of files, and thought, well, this is going to be an interesting experiment, 2 weeks at home. Well, Gabe, you went through it too. 2 weeks turned into 4, 4 weeks turned into 8. The next thing we know, we're what, 15, 18, 19 months into it, working in a hybrid. Some of us are in the office part-time, some of us aren't. But I will tell you from from March of 2020 to May of 2020, we saw a 114% jump in the number of people who had gone online and taking one of the screenings. And we thought, oh my gosh, we've got to tell people this tool is out there. So we started a communications campaign with News Channel 5 here in Nashville last year, and it ran from October 2020 to March of 21, and screenings jumped by 284%. So we know people are curious, and we know people need help. And we hope that is reducing the stigma around asking for help, so that everyone has the courage to go and seek help and understand the next steps that they could take on their own journey.
So let's talk about people who are taking these. One of the questions that came up is who should take a screening?
Anyone. They're really built. The youth, I I would say maybe 10 be the minimum age for the youth, but anyone through 65 plus should be able to take a screening and benefit. We know that so far, because we've been collecting the data from the screenings actually for about 7 or 8 years, but the consistent largest age group is 18 to 35 is who takes most of the screenings.
Male, female, sort of a
Uh,
mixture,
It almost runs a
irrelevant.
little bit, no, it almost runs a little bit even. It skews a little bit more, maybe about 52, 54% female, 48 or so male, but it is mostly female. But we've been surprised over the last couple of months to year how many more males have logged on to take a screening.
I really wish my fellow males would understand that you can ignore mental health all you want, but ignoring mental health is sort of like ignoring that weird knock in your car. It doesn't make it go away. It just leaves you stranded 2 hours away from home in the middle of a snowstorm. So I highly, highly recommend getting it checked out. And a screener is a wonderful place to start. Now, I know that you sort of address this. We just want to be super clear since somebody asked. You take the screener. What do you do after the screening? And both in terms of if the screener detects something. I know you talked about making an appointment. But what if the screener detects nothing, but you're not convinced?
Oh, if I were to take the screen and it didn't show the results that I anticipated or I expected, then I would call my personal physician and ask them to do some follow up. Uh, it's safe to be a little skeptical. I think that's good as well. Have a healthy sense of skepticism. But if you're concerned enough to take the screening and then you're concerned that the result maybe isn't what you wanted, I think you should definitely follow up with your professional.
I think it's definitely a good idea to be overcautious. I think this a lot. When it comes to physical health, if we think something's wrong, we expend all this energy. We show our friends, hey, does that look weird to you? We start showing weird coworkers, pulling up our pant legs, and hey, what's that look like to you? You got one of these, Bob? We make appointments with doctors, nurses. Forget it if you have a provider friend. That person is just tired of getting your phone calls in the middle of the night. You make an appointment, you get it checked out. You don't know what it is. You're not sure what it is. You have no idea. You're just concerned that something's wrong. When it comes to mental health, we go the opposite way. We talk to nobody, and unless we can diagnose it ourselves, like we have to sit down and say, hello, I have schizophrenia, and I developed it about 3.5 years ago. I feel that I have these symptoms. Here is the insurance code number in the DSM-5 diagnostic criteria. No, you just have to consider that something might be wrong. You can take a screener to get a little more backup, or you can just go straight to your general practitioner, your doctor, get a wellness check. Jackie, can you talk a little bit about that? Because so many people believe that unless they have irrefutable proof of a mental health issue, that they don't deserve care, and we want to convince them otherwise.
We do want to convince them otherwise, Gabe, because think about it. Who would wait till they had stage 4 cancer to go try to get help or treatment? And a lot of times people want to hit rock bottom before they think, oh my gosh, maybe there's something wrong with my mental health. Usually most mental health conditions start around 14, but maybe don't fully present until their early 20s. So that's something to definitely be concerned about. You want to keep check on that as you're going through your pediatric visits with your child and your young adult visits when you graduate to a family practice physician or internal medicine physician. Definitely ask about your mental health. And also, sorry, Gabe, I had a thought there for a second.
I do that all the time.
I know, but since most of the conditions don't present until a little bit later, you just want to be very cognizant of what to look for and that it's okay to ask for help. Um, don't wait until somebody's committed a crime or don't wait until somebody has attempted suicide. Try to intervene and step in beforehand and don't be too scared to ask questions. It's okay to not be okay.
And it's okay to be wrong as well, right, Jackie? What's the
It is.
worst? Let's say that you make an appointment with your general practitioner, your doctor specialist or whatever, and they give you a clean bill of health and just tell you to get a little extra sleep or
Yeah.
whatever the case may be. I'm not trying to minimize, I'm just not a but like that's wonderful news. That's welcome news. You didn't waste anybody's time. That's the purpose of getting
Yeah,
care.
exactly right. You know, having those feelings and then confirming that you are okay. Hey, that's great. Like you said, get a little extra rest. Maybe step up the exercise a little bit. Exercise is huge for mental health and mental wellness. You're all one. You're one big package. Your head's not separated from the rest of your body. And exercise and releasing those endorphins can be huge for helping you feel like you've accomplished goals. Um, I know for myself, I try to get up and get either to the gym or meet a walking buddy early in the morning and do that very first thing. And if I can just scratch that off my list at 5:30, 6 o'clock in the morning, then I know I can do anything the rest of the day.
That is excellent advice. A question popped up, which is I think very relevant. Why have I not heard about mental health screenings before? Is this new science? And of course, I want to sort of piggyback on that question. Jackie, is this based on science? This isn't just a bunch of random questions that people are asking. There was research that was put into this.
Yes, Gabe, you are 100% correct. This is based on science. All of the screenings are evidence based. Again, for whomever asked the question, remember, I am not a clinician, so I can't go into each and every one of the details. But at the end of all of the screenings, it tells you exactly which study they have drawn the questions from and based the testing rationale from. One of them, I think the depression screenings based on a PHQ-9 tool. Again, not being a physician, I don't want to get that wrong. But yes, all of the screenings are based on some form of medicine or research.
Now, we've got sort of a comment and a question. The state of Tennessee mental health webpage links you to Mental Health America, which is
Mhm.
where we have Jackie. So I see in Google search, there's of course many providers. I know that that's like Central Healthline. I mean, there's just a ton. I'm going to assume that the online screening site that you recommend, Jackie, is Mental Health America's. But
Yes.
I don't want to put words in your mouth. What screening site do you recommend?
Yes, I stand behind Mental Health America, the screening site that we have available on our website. I'm sure the other ones may be fine, but I am not familiar with those, so I don't want to speak on their behalf. But yes, I strongly recommend Mental Health America screenings.
I figured you were going to say that, but I didn't want to be so bold as to put it out there. And of course, it's also possible. Did Mental Health America create these screenings, or are they screenings from other researchers? Who developed the screenings, and how long have they been approximately in use with mental health or at Mental Health America?
Yes, staff staff with Mental Health America out of Washington, D.C. at our national organization developed the screening tools, and I know they've been in use since at least about 2014, 2015. And we've been collecting data for that long.
So they've been around a while. This isn't just something y'all threw up in response to the pandemic and hoped
No.
turned out okay.
Yes. No, they've been out there for a while, but also just want to point out because we are a small nonprofit and have not been a traditional advertising or communications partner, having the resources spent that way is probably why this is such a good best kept secret. But our response to the need and the pandemic was to ask our board for a special one-time um, disbursement of some funds so that we could launch a campaign and see what happened and respond to the need in the community. And it was overwhelming. The number of screenings increased by about 284%. And that caught the attention of the state of Tennessee Department of Mental Health and Substance Abuse Services. And they gave us a grant this year specifically to continue the communications campaign to promote the screenings for the entire state.
That is wonderful, Jackie. Thank you so much. We have another question that I believe that we have answered this question 100 times over, but let's absolutely be direct. Can anything really be found in an online mental health screen? I know that people like me are cynics and pessimists. So can you talk about how it finds things, how it works, and just really nail that down for us?
Yeah, because the questions are evidence based in the research and medicine and years of of treating people with a mental health issue. The screenings will let you know. Say, for example, you take the screening for the anxiety test. I know that in the month of September, 336 people took that screening. And of that, 11% of the people who took that particular screening tool came back with severe anxiety and that they need to go on and see someone. Um, the people who took that screening tool are given that information at the end of the questionnaire or the end of the survey. And they can take those results and go see their physician or nurse practitioner, therapist, psychiatrist, psychologist, and then open the door for a deeper conversation.
And that's really the beauty of it, right? Sometimes it can be difficult to start these conversations, but if you have the screener in hand, you can print out your results and just sort of why are you making this appointment? Because I took a screener and I got these results, and then your provider that you chose can follow up with questions. And it what do they say? A journey of 1,000 miles starts with a single step. But that step,
Right.
especially with mental health, can be extraordinarily difficult. Now, I know you mentioned this at the beginning, but let's go ahead and Kevin, you've been super awesome today. Thank you, Kevin.
Yes.
But my response is kept private on the MHA online tool to use that data to do statistical data research. I know that there is some research, but if I don't want to put words in your mouth, Jackie. Can you explain this to our audience, please? Because it's super important, right? Like you said, there's
Yeah,
stigma. I know that I don't want to take this and then find out, on Facebook, hey, Gabe has anxiety, or if it's my private medical information.
exactly. And Gabe, you're absolutely correct. The responses are kept private. We do not capture your name or any identifying information. We do ask for demographic data such as male or female, LGBTQ, if you have other co occurring disorders, if you have other physical issues such as cardiovascular problems or diabetes or obesity. We ask if you're currently seeking or currently in treatment. We ask for your zip code if you want to provide it or not, household income, age, occupation, but we do not know who you are. It is strictly confidential. And yes, our national office does publish 5 or 6 reports a year on different conditions and doing analysis of all of the data nationwide.
So just to clarify, Jackie, you don't actually ask for my name or my home
No,
address or my phone number, or do you ask for my email address?
no, don't even ask for your email address.
None of that. So everything is so the only data that you collect is really probably the same data that Facebook already has.
Well, we probably don't have as much as Facebook does. Um, so yeah, Facebook probably knows more than we do.
I am certain that they do. Another question popped in. Kyle has a great question. Do you partner with other organizations to provide a warm handoff to mental health providers for those who screen positive? Are we worried that the screeners will disclose more people with mental health needs than people who can help? So it's a big question from Kyle, but I know you're up to
Yeah,
the task.
yeah, Kyle, that's actually a great question. We did spend a lot of time last year before the pandemic hit to provide more resources to our national organization to help build out that back end of the website. So that way, if you do need help and you're not currently working with a physician or therapist, then you could type in your address or a zip code and try to find resources within 10 miles to 25 miles. And we also have been working with Memphis and some people in city government in Memphis to build out a resource directory just for the Shelby County area and surrounding counties in that metropolitan statistical area. So we do have a warm handoff if somebody happens to call our office and say, hey, I took this screening and I'm looking for a provider or looking for next steps, then someone in our office could help make a referral for you or talk through your needs. Um, but I know that the system, much like other systems, is stretched as far as the number of providers. But I don't think we'll overflow it or overrun it too much that we can't get people the help that they need.
Wonderful. Jackie, thank you so much. I know if there's any more questions, now's the time because we're getting ready to head on out of here. But the website, of course, is that the correct website? MHAMidSouth.org.
Yes, that is it.
You can
So
find all of those screeners there. Can you give us any
yeah,
more information about the program, the process, or anything that our viewers don't know but need to?
well, I can actually just a little side note. I wish I had paid a little bit more attention yesterday, Gabe, because what you said a little bit earlier in our conversation about men seeking help. I was watching Fox NFL yesterday morning, and Glazer and Michael Strahan and Jimmy Johnson and Terry Bradshaw and Howie Long and Kurt Menefee, they were all talking about some of the NFL football players who had come forward with some mental health issues and the nerve that it took for them to do that. And just really want to encourage people. It happens to everybody. We either know somebody, family, friend, or even ourselves who has had to ask for help at some point. And if the screening tool is the starting point for you to go in and decide if that's what you need for yourself, that's great. If you want to recommend it to a friend you think could benefit, even better. Because none of us want to wait until a crisis moment hits when we realize, oh my gosh, I really should have stepped in before now.
I completely agree. Thank you so much, Jackie. And super, super thank you for being here. And thank you, everyone, for being here. Everybody watching, we've gave you all the information. Now, if you watched enough of these over the last year and a half, what I'm going to say. I'm going to say you got to sign up for NAMI Tennessee's email list. Just go to namitn.org and you'll find out about all the cool things we do, including stuff like this. See, if you were on the email list, you might be watching this live. Okay, it's live right now, but the next person who watches it in like 20 minutes from now will not get the advantage of the awesome aura that Jackie and I put out live. So please sign up for that and just learn everything about NAMI Tennessee. Thank you all so very, very much. And we will see you next Monday at 2 Central, 3 Eastern. Bye, everyone. Big waves.